5 health checkups you should avoid after 70 that may harm you. There's a truth most seniors never hear from their doctors. Some common health checkups after 70 might actually do more harm than good. Each year, millions over 70 undergo routine screenings, believing it's the safest choice. But mounting evidence shows that for many, these tests can trigger a harmful chain reaction known as the cascade of care, leading to unnecessary worry, treatments, and even life-altering surgeries. This isn't about ignoring your health, it's about protecting it. Here at Nitro Wellness, we believe in arming you with the knowledge to do just that. You see, many screening guidelines were created for younger adults, not 75, 80, or 85-year-olds. As we age, the focus shifts. It's not just about finding diseases early, it's about avoiding harm, preserving independence, and enjoying life now. Many tests only help if you're expected to live another 10 years, because that's how long it may take to see any real benefit. But the downsides, like anxiety, invasive procedures, or side effects, happen right away. And that's where overdiagnosis comes in, finding conditions that might not cause symptoms or problems in your lifetime. In this video, we're breaking down 5 checkups you should question after 70, based on science, so you can make smarter, safer decisions with your doctor. Let's start with one that's become a routine part of heart health. And stick with me, because number 1 is the most common and carries some of the most serious risks. Number 5, routine cardiac stress tests for asymptomatic seniors. We all hear the stories, a friend who seemed perfectly healthy one day and had a heart attack the next, so it's natural to want to get ahead of it with a cardiac stress test, where you walk on a treadmill hooked up to an EKG. It sounds reassuring. But here's the shocking and uncomfortable truth. For many seniors who are asymptomatic, meaning you have no chest pain, no new shortness of breath, no dizziness, this test often causes far more harm than good. Here's why. First, the rate of false positives is alarmingly high in older adults. The test might say there's a problem when there isn't one. Many people over 70 have normal age-related changes in their heart, like a little plaque in the arteries, the equivalent of wrinkles on the inside. A stress test can flag these harmless changes as an abnormality, triggering fear and that cascade of care. A false positive test is rarely the end. The next step is almost always a cardiac catheterization or an angiogram. This isn't a simple blood draw. It involves threading a tube through an artery in your groin or wrist up to your heart. The risks aren't trivial, especially for older adults, and include stroke, heart attack, and kidney damage. And here's the kicker. Many patients who have an angiogram after an abnormal stress test are found to have no significant disease. They went through a risky procedure for nothing. Let me tell you about Harold. He's 78, feels great, but his doctor suggests a routine stress test. A small blip shows up. This leads to an angiogram, which finds some mild plaque not blocking blood flow. But just in case, a stent is placed. Harold then has a complication from the blood thinners he now needs, landing him in the hospital with internal bleeding. He spends months recovering, weaker and more scared than before, all from a test he didn't need. Leading medical groups like the U.S. Preventative Services Task Force now recommend against routine cardiac stress tests in low-risk, asymptomatic adults. The smarter alternative: manage your known risk factors, blood pressure and cholesterol, and pay close attention to new symptoms like chest pain or sudden shortness of breath. A number on a machine when you feel fine is not a red flag.
Number 4. The routine pap smear after 65. For most women, the pap smear has been a non-negotiable part of life. It's one of modern medicine's greatest successes, so the idea of just stopping can feel irresponsible. But here's a perfect example of how medical wisdom must evolve. For women over 65 with a history of normal screenings, continuing routine pap smears is a textbook case of a test where the harms now outweigh the benefits. Let's look at the science. Major medical bodies like the U.S. Preventative Services Task Force and the American Cancer Society agree. Women can safely stop this screening around age 65. This is for women with a consistent history of normal tests and no history of high-grade precancerous cells. Why stop? First, cervical cancer is typically a very slow-growing cancer caused by the HPV virus. The chances of a new, dangerous cancer developing in a woman over 65 who has been regularly screened are incredibly low. The vast majority of cases found in older women are in those who were never screened properly. Now, think about the harms. An ambiguous result, which is common and rarely means cancer in this age group, will lead to a colposcopy. This is a more invasive procedure where a doctor takes biopsies from the cervix. It can be painful, cause bleeding, and creates a tremendous amount of stress. And in almost every case, for a woman over 65 with a history of normal tests, that biopsy will come back benign or harmless. You've been put through hell for no health benefit. Continuing to screen after 65 is like having a hypersensitive smoke detector in a kitchen where you've never had a fire in 40 years. The chance of it finding a real fire is now tiny, but the chance of it going off every time you make toast, causing panic, is quite high. This is a conversation to have with your doctor, not to ask if you should stop, but to confirm that your history makes you eligible to graduate from this test. And if you're finding this advice empowering, make sure you subscribe to Nitro Wellness so you don't miss our future videos. Number 3. The routine PSA test for prostate cancer in men over 70. For decades, men over 50 were told to get an annual PSA blood test. The message was simple. A high PSA could be cancer, and catching it early is always better. But now we know the harsh reality. For men over 70, routine PSA screening is a textbook example of a test that causes profound, life-altering harm with almost no benefit. The problem isn't the test. It's what comes next. The core issue is overdiagnosis. Most prostate cancers found in older men are turtles, not rabbits. They are incredibly slow-growing cancers. A man would likely die with prostate cancer, not from it. But the PSA test can't tell the difference between a harmless turtle and a rare, aggressive rabbit. It just gives you a number. A high number triggers the cascade. The next step is a prostate biopsy, where a doctor inserts a probe into the rectum and takes a dozen or more tissue samples. The risks include serious infection and bleeding. If that biopsy finds even a few cancer cells, a man faces a terrifying choice: surgery or radiation. The side effects of these treatments are devastating. The risk of permanent severe urinary incontinence is significant. The risk of permanent erectile dysfunction is even higher. Let's be clear. We are taking healthy men with no symptoms, giving them a test that leads to a diagnosis of a cancer that would likely never have hurt them, and offering treatments that have a high probability of leaving them incontinent and impotent for life. This is why the U.S. Preventative Services Task Force recommends against routine PSA screening for men 70 and older. The empowered approach is to focus on actual symptoms. If you have trouble urinating, bone pain, or unexplained weight loss, that needs to be investigated. But chasing a number in a healthy man is a path filled with peril. Sometimes the wisest medical decision is to do nothing at all. We're more than halfway through, and this is a lot to take in. Here at Nitro Wellness, we want to hear from you. Have you or a loved one ever felt pressured into a medical test you weren't sure about? Did you regret it, or did you say no? Share your story in the comments. Your experience is powerful and could help someone else feel more confident.
Number 2. The routine screening mammogram for women over 74. This one feels just as controversial. The annual mammogram has been a pillar of women's health, but the science of aging demands we look at this with fresh eyes. For many women 75 and older, continuing routine screening mammograms can trigger that same cascade of harm for very little benefit. First, let's be clear. We are talking about screening mammograms for women with no symptoms. If you find a lump or have other changes, you absolutely need a diagnostic mammogram, no matter your age. The issue, again, is overdiagnosis. As women age, they're more likely to develop very slow-growing breast cancers. A study in the Annals of Internal Medicine found that for women aged 75 to 84, a staggering 47% of breast cancers found by screening were likely overdiagnosed. That means nearly half the cancers found might never have needed to be found at all. But once it's found, you're labeled a cancer patient. This almost always leads to surgery and often radiation. For an older woman, even a minor surgery can be a major setback. Then there's the harm of false positives. Imagine the terror of that phone call saying, "We found an abnormality." This leads to weeks of anxiety, more imaging, and often a needle biopsy, all for something that most of the time turns out to be harmless. This is why guidelines are changing. The U.S. Preventative Services Task Force states that for women 75 and older, there is not enough evidence to know if the benefits of screening outweigh the harms. The empowered path is to have a real conversation with your doctor about your health and your values. For a healthy 75-year-old with a strong family history, screening might be a reasonable choice. But for an 80-year-old with other health issues, the risks of the screening cascade likely outweigh any potential reward. The choice should be yours, and it should be informed. But hang on, because the number one test we need to discuss is the most invasive of all.
Number 1. The routine screening colonoscopy. And now for number 1. The test that has been hailed as the gold standard for preventing colorectal cancer. In our 50s and 60s, it's an amazing tool. But as we cross into our late 70s and 80s, this invasive procedure can become one of the biggest sources of harm in preventive medicine. Of all the tests on our list, this one is the most dangerous, and the risk starts with the bowel prep. It requires drinking powerful laxatives that cause severe diarrhea. For a senior, this isn't just unpleasant, it can be a serious medical event, causing dehydration, dangerous electrolyte shifts, kidney injury, and falls. Then there's the procedure itself, which requires sedation and carries a real risk of bowel perforation, a hole poked in the colon that requires emergency surgery. The risk of perforation and serious bleeding goes up significantly with age. Now, weigh those immediate risks against the benefit. Remember the 10-year rule? It takes, on average, at least 10 years for a small polyp to grow into a life-threatening cancer. Finding and removing a polyp in an 80-year-old with other health conditions provides almost no survival benefit. They take on all the risks for a benefit they are statistically unlikely to live long enough to see. This isn't a fringe opinion. Major medical groups, including the American Cancer Society and the U.S. Preventative Services Task Force, all recommend stopping routine screening at age 75 for most people. Between 76 and 85, screening should be highly selective, and after 85, it is almost never recommended. The safer, smarter alternative? For many, it's a non-invasive stool-based test like FIT or Cologuard. You do it at home. No prep, no sedation, no risk of perforating your bowel. If the test is positive, then you can have a conversation about whether a follow-up colonoscopy is worth the risk. So, there you have it. Routine cardiac stress tests, Pap smears, PSA tests, screening mammograms, and routine colonoscopies. 5 common checkups that for many people over 70 can cause more harm than good. The goal here isn't to make you fear your doctors, it's to empower you. It's to turn you from a passive passenger into a confident co-pilot in your own healthcare, which is our entire mission at Nitro Wellness. The guiding principle is no longer more is always better. For seniors, the wisest approach is often less is more. True health after 70 is about the quality of the life you are living. The next time a test is suggested, you can now ask the critical questions. Based on my age and health, what are the odds this test will find something that would never actually hurt me?
What are the risks of the follow-up procedures? And most importantly, how will this test help me live a better life, not just a longer one? This is the new frontier of senior health. It's about choosing quality of life over quantity of procedures. If you found this information valuable, please do 3 things for us here at Nitro Wellness. Click the like button, subscribe for more evidence-backed health advice, and most importantly, share this video. Send it to a friend, a parent, or anyone over 70 you care about. You could be giving them the gift of confidence and protecting them from a world of unnecessary medical harm. Thank you for watching.